welcome you all to Doon Hospital again. Today I am welcoming Dr. Gaurav sir. I want to tell you all about Gaurav sir. Gaurav sir is presently the director and senior consultant of Drishti Eye Foundation Merit, and sir is an alumni of KGMC Lucknow. Then sir did his training from Agarwal Eye Hospital, Chennai, and sir is doing more than 2500 and many more surgeries per year. Sir was the first one, the pioneer to start topical phacos and optic in western Uttar Pradesh region, and there are so many awards on sir's name. I'll fall short of time if I list. So telling about the case, for sir, we have a 65-year-old male. He has a diminution of vision in his left eye since past 3 to 4 months. The lens grading in left eye was LOX classification and not 4, NC4, cortical cataract grade 2 and PSC2. So the vision was 3/60 and the fundus was media clarity grade 1 and within normal limits. His steeper axis is steeper by 1.74 diopters at 138 degrees, and the axial length is around 22.60 millimeters. So his IL power was calculated to be plus 21 diopters. So we are using Hoya Vivinex toric lens for him. Handing over the case to you, sir.
Welcome, Bala Chaturvedi here from Kanpur. Welcome you. Gaurav, you have started already?
Good morning, sir.
You have already started?
Good morning and welcome.
Welcome you.
Welcome you also, sir. back from Chennai.
Yeah. So, Gaurav, what you are going to do, just tell us.
What I am going to do is
differently from other,
magic. I am just making a 2-port entry, not a 3-port entry. I am using this machine for the very first time, and as Dr.
Which machine you are using?
Faro's machine.
Okay. Artley. Very good machine, no doubt.
No doubt about it.
But still, then we all have used for the first time.
Yeah, and new OT, new assistants, new scenario.
This is always the beauty of the life surgery.
So let us hope that it goes off well. So we have cracked the nucleus into 2 parts. Parakin डाल दो बेटा. बाबूजी के दर्द हो रहा है.
Gaurav is astonishing surgeon in Meerut, practicing for last so many years. We have seen watching him. So he has divided the nucleus in 4 parts now, and almost he has finished the case.
So you see that doing the live surgery is quite challenging. You have to have a different setup than your routine OT. You have to have different instruments. You have to have different machines.
Yeah, main thing is different machines.
It become very person is not accustomed. So it's become very difficult to do surgery in such conditions. But expert surgeons can make and do anywhere or with anything.
Now I have got something in my.
Sir has already done toric marking. While putting IOL, sir will brief about how to proceed for a toric lens. You must be seeing blue staining.
Sushil, before toric marking on the OT, have you done the toric marking in the OPD also on slit lamp or
yes,
no?
Sir. Before surgery, we have done under the slit lamp, we have done the toric marking. And also we have marked, Gaurav sir has marked the vessels also, conjunctival vessels also he is using as a marker.
Yeah.
For the.
So how you have marked, you have just marked by the 90-180 degree or you have used the bubble marker?
Sir, 90-180 degree with the bubble marker.
Bubble marker. So there are different techniques to do the toric IOLs. You can mark on the slit lamp without the bubble marker. There's not much need of a marker.
To discuss with Gaurav sir, he generally makes both things ready. He also sees the vessels alignment at the different degrees also. Yeah. Because sometimes the marking may go off due to the fluid irrigation during the surgery. So he has already planned a backup plan with the help of blood vessels also.
Sushil, this is a really good thing nowadays because whatever we have biometer we have, they also show the vessels, blood vessels, where you can mark the toric IOL. So instrumentation has definitely, technology has definitely advanced. We should always try to mark the vessel because vessels are not going to lose, marking can be lost.
Endocapsularing hai?
Gaurav, you are having some problem. I think there's some issue because we can see something is lacking here, there, no?
Yes, there are the essence of the zonules. So
Yeah.
a bit of trouble.
I can observe that jalous weakness.
Hi. Hello, how are you?
So I'm looking for an endocapsular ring.
Okay.
So the toric eye, this is the toric IOL marking. We can see placement of lens is at 138.
So if you are putting toric marking with the dye, sometimes it can wash off during the surgery also or also. So the best thing, or if you got a smudging there, sometimes you're putting patient moves and you don't get a proper marking or it's too big to make a thing, you can use a 26 needle and you can make a scratch on the cornea at that angle. That persists there for a long period. So that's one tip. Second is taking a photograph. We got a lot of instruments now, which can be rather apps which you can use on your smartphone also. So you can take a photo with your all calibration there. If you have got good instruments, that's good. If you don't have, you can use a simple iPhone or some instrument, smartphone. That's got a very beautiful app.
Dr. Arora, we don't have
please.
an endocapsular ring in here. So I'm sorry, we will have to go ahead with our simple techniques like putting down all the parameters.
Right.
I think absolutely agree with you, sir. Is the needle marking? I personally feel is the best technique on the slit lamp because you know your markings are like deep and this, and there's no way of it getting washed. The other thing is also once you've done the marking, please do draw it on a paper of how you've done the marking. Sometimes it's not always bang on one line. Sometimes you'll have two lines there. Always draw it on a paper so that in the OT you have a clear picture on which is the right marking. So always draw it and you can follow it.
Sir, I have been advocating since 2-3 years that instead of 26 gauge needle, please use a crescent knife. This gives you exact amount of access because the moment you scratch with the 26 gauge, it is more than 5 degrees. So use a crescent and use both the sides. That helps you.
Visual on. Visual on. Feel on though. So now first I'm planning to implant the lens first and then I'll take care of the cortical matter which is there. I'm trying to lift it with this technique. बत्ती में देखिए बाबूजी.
So about the marking, I just wanted to share different technique apart from the markerless system.
Yeah.
After marking in front of the slit lamp, there are a lot of people even use something called the Patwardhan toric marker. That is a Patwardhan toric, which has been designed by our good friend Saurav Patwardhan from Sangli. That is a mobile app where we should download. So some people mark on the OT table, then they take the photo with the app, then they have to coincide with those mark with the app. The app will tell exactly how much is the rotation of your marking. And we have done a study actually to compare with the markerless. This Patwardhan marker is quite accurate compared to the even markerless system.
Lens.
I think we got a lot of apps. One is from Barrett marker there. One is the iToric app. All these are good. And they work better with iPhone because the iPhone has a gyroscope. So your 0-180 degree will be always there, whatever way you hold the phone. So that will not be lost. So suppose your patient is tilting or your phone is little tilted, but still you will get the proper access. So using iPhone is little superior to other phones because your conditioning is quite perpendicular. You could get a 0-80, whatever the condition you keep your phone.
So in these kind of
And
scenarios,
you can use it also for validation also. I mean, so you've taken a photograph with all those grit marking there, then you can have the picture very clear where your incision is going to be. And you can align.
So this is what I am doing is I am using
Hello.
IOL as an scaffold for implanting my lens. Now,
so if you have a scenario like this where you have a nucleus plate or epinucleus plate like this, one of the very useful things about 45-degree tip is where you can just direct the 45-degree tip or the bevel downwards, be at the level of the iris, make sure the chamber is stable, obviously, and then turn on just the vacuum, automatically these pieces come up. So the key is to, point the bevel downwards, the pieces come to you.
What are you doing, man? Gaurav? You're taking a class here?
So he's trying some scaffolding technique here.
yeah. I've implanted the lens.
So this is called lens scaffold. Lens is taking care of.
So he has a problem, then he has tried to do the scaffold lens. There's a jadul weakness, we can see.
One.
So now we have come to the Chennai again. Dr. Mohan Rajan, welcome.